A shocking reality is unfolding in Britain, where an increasing number of people are being forced out of work due to long-term sickness. This issue is not just a concern for individuals but has far-reaching implications for the entire economy. The human cost of long-term sickness. Roni Jones, a former NHS manager and self-proclaimed workaholic, knows this reality all too well. After collapsing in her garden, she was diagnosed with a debilitating neurological condition, joining the ranks of 2.8 million others who are unable to work due to long-term sickness. "I can't even imagine being able to get up, get ready, and leave the house regularly, let alone go to work," Jones, now 63, shares. Her condition causes her immense pain and fatigue, a stark reminder of the physical and mental toll that long-term sickness can take. A growing trend. The numbers paint a concerning picture. Today, there are 800,000 more people of working age off work due to long-term sickness compared to 2019, an increase of 40%. Additionally, the number of working people reporting a work-limiting disability has risen by 30% to 4.1 million in the same period. If this trend continues, the cost to the economy in lost productivity could reach a staggering £66.3 billion by 2030, according to forecasts. Health issues. A pincer movement. Health issues are impacting the workforce in a unique way. Mental health problems are affecting those at the start of their careers, while musculoskeletal issues are taking their toll on those nearing retirement. Let's delve deeper into these conditions. Conditions limiting work. Since 2015, the number of affected staff aged 16 to 34 has risen the fastest, with an increase of 1.2 million or 77%, according to the Department for Work and Pensions, DWP. Almost half of these individuals, 530,000, reported a mental health problem as their primary condition. The second largest rise was among workers aged 50 to 64, with an increase of 900,000, and musculoskeletal issues accounting for 140,000 of these cases. Conditions leading to complete work absence. When it comes to conditions that have forced 2.8 million people to stop working altogether, the picture becomes more complex but follows a similar pattern. Mental health is the leading cause, with 28% of people citing it as their main condition last year, according to ONS data. This affects people of all ages, with 14% aged 16 to 24, half aged 25 to 50, and just over a third, 36%, aged 50 to 64. Mark Rowland, chief executive at the Mental Health Foundation, highlights a concerning trend, a really big drop-off in young people transitioning from education to work. This has significant economic and social costs, and if not addressed, could have a much greater impact than someone leaving the workforce in their 50s or 60s. Musculoskeletal conditions are the second most common reason for long-term sick leave, affecting 21% of those off work. The vast majority of these individuals, 71%, are aged 50 to 64. Other prominent conditions across all age groups include chronic digestive, circulatory, respiratory, and nervous system diseases. Money worries and mental health. Rowland explains that there are four mega trends behind the rise in long-term sickness due to mental health issues. The first is a positive one, less stigma leading more people to seek help. However, rising economic insecurity and inequality are also factors, as research has linked income to poor mental health. In 2022, at the height of the cost of living crisis, 21% of people without a previously diagnosed mental health condition told YouGov that worrying about money was making them feel depressed. Berkshire GP Adrian Hayter has noticed more patients with finance-related stress, as well as those working for small companies where bosses have passed on the pressure of a difficult business environment to their staff. Small businesses are also less likely to have occupational health services, according to the Chartered Institute of Personnel and Development, CIPD. Rowland adds that existential, global shocks like the pandemic, climate change, and higher-profile conflicts contribute to greater uncertainty and stress. The unregulated and ever-growing influence of the online world also plays a role. There has been an increase in work intensification due to the increasing digitalization of work, which may be linked to an increase in stress, says Ben Wilmot, head of public policy at the CIPD. While short bursts of stress can increase performance, prolonged exposure is linked to anxiety, depression, and heart disease, he warns. The UK's work culture. The UK stands out among its European peers in terms of work culture. Half of all British workers often work more hours than expected, the highest rate in Europe, according to a survey. Only a third of British workers say they have control over how they work, the lowest rate in Europe. Heavy workloads are the top cause of stress-related absences in the UK, the CIPD found. Why are musculoskeletal problems worsening? There's no doubt that the aging workforce is a significant driver, says Wilmot. A large number of baby boomers are approaching retirement, while the average number of children born to a woman in England and Wales over her lifetime has dropped below the level needed to sustain the population since 1973. The median age of people in the UK was 33 in 1973, now it's 40. It is likely that this changing age composition will continue to apply upward pressure to inactivity volumes in the next few years, the Office for National Statistics says. Huge NHS waiting lists have only exacerbated the issue. When you're waiting in pain and working, it obviously affects your physical and mental health, says Hayter. The NHS waiting list stood at 7.4 million cases in August, with 40% of people waiting for more than 4 months, according to the British Medical Association. A third of economically inactive people said they were waiting for NHS treatment in a 2023 ONS survey, the most recent data available. And a third of employed people waiting for NHS treatment said it affected their work. Failure to treat physical symptoms can lead to mental health problems, with 59% of people who are economically inactive due to long-term sickness experiencing moderate to severe depression. The role of employers. Claire McNeil, Chief Executive of TimeWise, a non-profit consultancy on flexible working, asks, are we really looking at the quality of work and what role that is playing in increasing sickness rates? Why aren't they, employers, offering the sorts of flexibility that young people who might be managing a mental health condition need? Some of this is about the post-COVID generation entering the workplace, so there's a moral responsibility that we have to ensure they get good quality employment. There were 1.77 million workers suffering from specifically work-related ill health in 2022 to 23, resulting in 31.5 million lost working days, according to the Health and Safety Executive. Some 875,000 staff members endured work-related stress, depression, or anxiety, while 473,000 had musculoskeletal disorders due to their job. Conditions are often neglected by employers or by the government, says Hayter. Inadequate line management is partly to blame, adds the CIPD's Wilmot. Not enough employers are training their managers to manage people properly. It shouldn't be rocket science that managing people is important. Clear objectives, boundaries, behaviors, and values, as well as a compassionate approach to health, are key, agrees Rowland. A study by the University of Nottingham and Queen's University Belfast last year found a strong association between mental health training for line managers and lower levels of long-term mental health sickness absence. However, only 29% of organizations provide this training, separate CIPD research found. We don't want line managers being therapists, but it is really clear that the biggest factor in terms of your mental health in the workplace will be about your relationship with your line manager, Rowland says. Hayter adds that employers expect too much of GPS. We lack consistent, coherent support from the employer side around how to support people back to work. Doctors can't understand every workplace, so their time is best spent seeing patients and dealing with daily pressures, he says. Hayter recently saw a patient who was given a fit note advising a slow return to work with workplace support, but the employer declined and recommended the patient stay off sick. This anecdote reflects the data. Approximately 43% of employers don't have a strategy for well-being at work, the CIPD found. Jane Grattan, Deputy Director of Public Policy at the British Chambers of Commerce, BCC, says businesses are struggling to know what they can do to help. More than ever before, we're finding employers proactively talking to us about this, and saying what can be done, she says. While they can support well-being in the office, there's not much an employer can do about issues that are outside of the workplace that will impact on people's health and well-being. The government's plan. The government plans to spend £1 billion over the course of the Parliament, embedding job advisors in GP surgeries through its Connect to Work programme. Prevention versus cure. The whole system needs reform, says Rowland. Our system invests